All right, so it is officially May, and May is Mental Health Awareness Month. And I kind of just wanted to get on here and share my story because you never know when your story can help somebody else, and you never know if somebody feels alone and they feel like, their situation is not relatable. It is. So, I was diagnosed with anxiety and depression when I was like 19 or 20. I think I had issues long before that. I just didn't recognize what was going on. And I think I was just so young that I was like, I don't want to ask for help. I don't know what's wrong with me. I know when I was younger, like in my teens, I would really kind of like lash out when I got angry, and I felt like that was an issue. Like, why am I getting so mad at the dumbest stuff? Why am I lashing out like this? Why am I trying to fight everybody? Like, I think I was so confused in my head about what was really going on that I just kind of released it any way I could, which was through anger. I wasn't even diagnosed until after, years clearly, and things got really bad. I wasn't diagnosed with anything until after I had a suicide attempt. So when I was like 19 or 20, I was just really overwhelmed. There was a lot going on in my life at the time, and there was me trying to wrap my mind around what's wrong with me and what's going on with me. So I took a bunch of pills. They were prescription pills. They were not mine, but I had access to them. Took a whole bunch of pills, and I'll be honest, I really don't remember much. I remember waking up in the hospital and seeing a bunch of my family members there, and that stuck with me because it was like, okay, I have a support system. They may not understand what's going on with me mentally. I don't even understand what's going on with me mentally yet, but I do have a support system. I have people who care about me. So I guess like during that time I was in the hospital, I guess I signed myself up to go to a mental facility for 3 days. So I really don't remember much from being in the mental facility either. I don't think I had a roommate. I was only there for 3 days, but I don't think I had a roommate. There was like an in-house therapist. I really don't remember her at all. I know obviously I met with her because that was, required, but I don't remember our conversations. And I know that there really wasn't anything to do. I can't remember if there was a TV. I know there was like board games and stuff, and you can, hang out with the other patients that were in there. But they had this closet full of books, and that's really kind of when my reading obsession began, because it was a way for me to kind of step out of my reality for a little bit. And to this day, when I get really overwhelmed or stressed out, I do read. You guys know I read a lot anyway, but especially when I'm, depressed or going through something, I really, really like to just grab a book and kind of just escape for a little bit. When I was in that mental facility, I think that was kind of where I pinpointed that I wasn't alone. Like, I'm not less of a human because I have a mental issue. I'm not, I may not be normal, but what is normal anyway? So it kind of made me feel better to know that there were other people out there and that I wasn't alone in the situation. So after that, I of course met with the doctor. I got on some antidepressants, and then I had gotten my own therapist, and I don't think I was really ready for therapy at that time because like I would mostly talk to her about like my relationship at the time and friendships. Like, I didn't go back into like any of the past traumas that I have. I really didn't hit anything that needed to be addressed. I don't think I was ready to open up yet. I don't think I was old enough yet to understand that, this trauma from, when I was like 5 may still be affecting me today. So eventually all that stopped. Like, I stopped taking the medicine, which don't do that. I don't recommend that at all. But I stopped taking the medicine. I stopped seeing the therapist, and I kind of just went on about my life. And I think when you do that, you'll notice that things kind of get worse throughout the years. So in 2018, I had moved. A lot of stuff was going wrong for me in my hometown, and I felt very, very triggered and I felt like I was going to lash out like really badly. So I was like, I'm gonna move. I'm just gonna, do what I gotta do, pack up and move. And so I moved to a new state. I moved somewhere where I didn't know anybody. I didn't have any friends, no family. I had no support system at all. And it wasn't until I moved that I had my first panic attack. And I was in public and it was just like, oh my goodness, I'm dying. Like you really never get too used to that feeling, because you're just I know that I like shake uncontrollably and I feel like my heart is about to come out of my chest. Like it's just, I cry every time. It was a lot. So I'm like, okay, maybe I need to get a doctor and a therapist here. So that's what I did. I went and I got a doctor and I got a therapist, and it was horrible. You have to be careful about the physician you choose, and even if it's just your PCP and your therapist, really take your time and do the research, because I had a horrible experience with both my PCP, who was prescribing my antidepressants, and my therapist when I was away. My PCP was switching my medication every 2 weeks, so my body was not adjusting to any of the medication. It was just like, I'm taking this, it's been 2 weeks, now I'm off this, I'm taking something else. And my therapist was just like a mess. Like she didn't want to know me and my issues as an individual. So like I felt like all my sessions were just a repeat of the first session, because she didn't write anything down, she didn't take notes. So she's basically re-asking me over and over again why I'm there, and I'm telling the same story over and over again. So I'm not learning anything, because this is just me repeating the same thing every session. So it got to the point where I was just like, I feel like a zombie. Like I'm on all this medication, all this stuff is mixing together, like my body is not okay, I don't feel okay. I felt literally like, if that's what I think that's what a zombie would feel like. So I was like, I need to do something else. I'm done. I'm done with this doctor. I am done with, this therapist. And that was over a span of like a year and a half, almost 2 years that I dealt with that. So I moved back home at the end of 2020. And I thought things would be better for me, because I thought that having my support system would make things easier. Like I thought, oh, I'll never have a panic attack again. I won't be depressed. I won't have the opportunity to be depressed, because, I'm going to be around my loved ones. And that, didn't happen. I was fine for like the first month or so that I was back, but then the panic attack started again. And I was like, okay, well, obviously I need help again, so let me get a doctor here and let me try another therapist here. So I did that, and I found a very good doctor who cares, who like really cares, and when you go see him, he remembers you from the last appointment. Like there's no question needed. Like knows why you're there, knows what we need to update, what we need to do, has a plan. So I initially just went and I got on something for my anxiety, and just to help like kind of control those panic attacks and stop them from happening. So I got on this medication for my anxiety. It works wonders. Haven't had a panic attack since. And then I got a therapist, and I probably learned the most dealing with this technically it was a fourth therapist, because she would basically, like I would answer my own questions and learn my own triggers just by talking. So she really didn't have to interfere much, because I knew what I was trying to get to, and I would hit it just by talking. So I'm like, I can just talk to myself at this point. And that is something that, has really, really helped me. I really, really know my triggers. I know, what causes my anxiety. I kind of know when I look around or take a step back and kind of review the scene, I know what caused the panic attack. And I typically will know what causes my depression as well. So, I saw that therapist for a little bit, and then I was like, I don't think therapy works best for me, because I've learned so much about my condition and about my body and my mind on my own that I'm kind of like, I kind of understand it better and I don't have any questions. Now, if questions come up or if something happens or, if there's some more trauma in my life, I would definitely go back to therapy. But I think I'm in a position where therapy is not something that I need right now. So I did have another few months of depression recently. So I was depressed for a couple of weeks, went to the doctor and was like, hey, I think I need an antidepressant too to go along with my anxiety medication. So I got on something and within 2 to 3 weeks, I was like, yeah, no, I don't like this medicine at all. I felt very, very, very depressed and I was getting those thoughts again in my head and I'm like, I cannot do this. I need help. So I went back to the doctor, got my medicine switched, and now I'm on something that I really think is going to work for me. I think the combination of what I'm on now and the anxiety medicine that I'm on now is really going to help me moving forward. It's all about kind of having the right people in your corner, especially when it comes to your physicians and stuff. But it's also about having a support system. And, I have a support system that does not understand, what I go through. They don't understand, mental illness. So it's difficult for them when it's happening and when everything is going on. But I've learned that I at least have a support system so I can sit them down and say, look, when I'm having a panic attack, this is what I need you to do. Or if I'm really irritable, just know this is typically how my depression starts. There may be a couple of days where I don't want to talk to anybody. Just know I'm not ignoring you. I'm not mad at you. Don't take it personal. It's just right now I don't want to talk to anybody. So I kind of my support system kind of learns from me what I need from them, even if they don't understand what I'm going through. So I think it's just really important that we really speak out about mental health because it's really not uncommon. Just to be honest, it's not uncommon. Like I said, does anybody really know what normal is? And so many of us are dealing with these mental issues and we don't know what to do. We don't know who to reach out to. We don't know how to go about it. We should 100% come together and be there for each other. And the best thing about that situation is that we would kind of understand each other. And, the coping mechanisms that work for me may not work for, the other person, but still to have somebody who has, gone through those situations as well, or, this medication may work for you, that medication didn't work for me. At least you have someone in your corner who gets it, who kind of understands what you're going through, and you have someone to vent to. So I really think we need to be more open about mental health. I myself honestly need to be more open. I was very depressed the whole month of April, and you could look at my, my social media and you wouldn't know. Literally nobody knew besides 2 of my family members. I haven't really been vocal about it, and it's not that I'm ashamed. It's just sometimes I get discouraged because not everybody understands and they want to call you crazy and they want to call you weird and they want to, say things, but it's there is no magic pill to take away my anxiety and depression. Nothing is going to make it stop. This is something that I have. This is something that I'm going to have to live with, but it's something that I can control and it's something that I can speak out about because maybe I can help someone else and I know that I'm not alone and I want other people to know that they're not alone as well. So my life is still going. Like I said, I was just super depressed in April. I'm 26 now and this has been going on really since 18, 19, and I'm learning more and more every day about, my condition and what I need and what my body needs.